the ERs are filled with our elderly population.
A Winnipeg family is calling for quicker improvements in health care as their 89-year-old relative waits on a stretcher for the 8th day in a row at the Grace Hospital.
So she's not really getting the care she's needed, and she's waiting to be sent to a geriatric rehabilitation hospital.
Helen Gorlick's mother, Helen Gorlick, has been sitting semi-upright since October 16th. She's been at the Grace Hospital since October 17th, waiting on a stretcher in the hallway because there's no physiotherapy staff in the building. Helen can't lie flat or bear any weight.
I think she should have been seen by physiotherapists pretty immediately in the ER to work on getting her out of bed and get her muscles moving. I find that's a detriment because she's sitting in a bed and she doesn't know what her abilities are, even like for mental health purposes as well too.
Gorlick, who has been visiting Helen every day, says this experience has been a wake-up call for him. He sees healthcare workers now firsthand who are doing their best to care for patients but don't have the resources they need.
What I've witnessed and seen, the care there is amazing. It's just the lack.
Not enough.
Not enough. And they're overworked. At the end of a shift, you're constantly hearing a supervisor coming around asking them to stay for a double.
I know it happens in every hospital, but for us this is personal because this has been ongoing.
Heather Denboer is Helen's daughter-in-law. She says the long-term wait is starting to cause other issues for Helen.
Her muscles are starting to atrophy. She doesn't have the type of care that she requires to get up out of the bed and get even to a washroom. So things are happening,
Denboer, who is a healthcare worker, says more staff is desperately needed so patients get proper care.
Being in the Grace Hospital emergency yesterday and seeing how few nurses and healthcare aides and doctors there are available for the number of people that were lining the hallways in stretchers and in the rooms, and in the area where I was all geriatric people, and it was heartbreaking to hear them calling out for help or hello.
Quite frankly, it's unacceptable. Manitobans should trust that when they go to an emergency room or an urgent care, that they're going to get the care that they need and they deserve in a dignified manner, and that's clearly what we've been told is not what's happening, and so very concerned about that.
Minister for Health Uzoma Asagwara says the new Manitoba government is committed to strengthening healthcare by listening to healthcare workers and patients.
My thoughts are with this family, and I appreciate that they have obviously reached out to have their voices heard.
Both Gorlick and Denboer say they hope the new government can make swift changes to ensure seniors don't have to wait weeks for care in emergency rooms. In Winnipeg, Joanne Roberts, City News.